Hello, I'm Dr. Kenneth Jordan, CEO and founder of Jordan NeuroScience. As a neurologist, a neurointensivist, and an authority in brain monitoring, I want to talk to you about brain injuries, a major need in our healthcare system. Every year, between 5 and 10 million people with serious brain problems are seen in our emergency departments. Sometimes they're admitted to our intensive care units, and most of these patients present with one of three problems: convulsions, confusion, or coma, or what I call the 3 C's. In fact, over 500,000 of these patients have critical brain injuries that require admission to the hospital. We know the longer a patient's brain suffers with these convulsions, confusion, or coma, the greater the risk of permanent brain damage. We also know that a simple test that's been around for 80 years, the brainwave test, an EEG, is essential to diagnosing and managing these patients, but it is almost never available in the emergency departments, and hospitals may not have the brain monitoring capability even in their intensive care units. 20 years ago, JNS established the first networked continuous brain monitoring program in the country, and we proved the importance of using EEG in acute brain injuries. In fact, we found that many patients had silent seizures that could only be detected with brain monitoring. Now, these seizures we call non-convulsive seizures are treatable, but if they're not diagnosed, they can produce additional and even permanent brain injury. I'm proud to tell you that today, continuous EEG monitoring is a national standard of care, largely because of our contribution, and it is used in major medical centers, having saved thousands of lives. But what about the medium and small hospitals in our nation that treat 70% of our population? They still do not have brain monitoring, and these patients are being left behind because the hospitals do not have the money or staff to implement relatively expensive EEG monitoring programs. This must change. Too many lives and too many salvageable brain injuries are at stake. In our emergency departments, things are even worse. EEG is available in fewer than 10% of all hospitals, even in major centers. Now, we know that time is brain, and the absence of brain monitoring for these patients delays their timely diagnosis and treatment. It increases the risk of permanent brain injury, their hospital stays, and the expense of taking care of them, as well as catastrophic effects on their families. Furthermore, in many cases, our local hospitals have to send our patients long distances to referral centers simply for brainwave monitoring. Of course, this further delays their diagnosis and treatment and interrupts their care. It also loses revenue to our local hospitals. Emergency EEG, we know, makes a major difference in the diagnosis and treatment when it is done. 62% of patients with convulsions, confusion, and coma have abnormal brainwave tests, and the results of these tests change the clinical diagnosis and their treatment in 55% of cases. Now, in the past, doing brainwave monitoring was time-consuming to set up. It used complicated equipment and required expensive and specially trained expertise, but no more. Jordan NeuroScience with Lifelines Neurodiagnostic has solved this problem. JNS's easy, rapid, and cloud-based solution of wireless EEG is perfect for emergency and ICU brainwave monitoring. It provides brain monitoring on a ubiquitous scale for all acute brain injuries in the emergency room, in the intensive care unit, and even in the ambulance setting. And we are proud to welcome you to the wireless EEG revolution. The BraiNet 10 electrode placement system makes it simple for anyone with minimal training to complete a patient setup within minutes. It can be used by EEG technologists, but it can be used just as easily by any allied health professional with no prior experience. Our system, the JNS system, is effective and accurate for screening the brain for seizures, stroke, lack of oxygen, or any general insult that interferes with brain function. Our electrodes are specially designed to be CT compatible, and many hospitals use them in their MRI scans, so there's no need to remove or reapply them or interrupt monitoring. And our system, our module, our WiEEG amplifier is so small, it sits on top of the head and starts recording with a simple press of a finger. And it's FDA approved for all ages and all medical environments. In fact, our signals have been compared with standard EEG brainwave, and ours are superior. The WiEEG system wirelessly transmits by Bluetooth our data, EEG data, to any Windows-based laptop, tablet, or mobile device for up to 70 to 100 feet. The data can be recorded continuously for days or weeks simply by exchanging the modules, and each module has a duration of up to 20 hours. The WiEEG system is HIPAA secured. JNS uses standard HIPAA Internet protocols. The data is stored in the cloud, a unique advantage for immediate reading by remote experts or comparison with previous recordings. JNS's WiEEG module has such a small footprint that it never interferes with standard care of the patient. It's important to look at the economics. So JNS's WiEEG system is consistent with Medicare requirements for standard billing and can be the source of unrealized revenue to your hospital and facilities. You can tell that this is a solution for brain monitoring in any venue for any patient. And I am proud to introduce you to JNS's wireless EEG system, and I know that together we will save brains.